What is an adjustment disorder? Adjustment disorders are basically having excessive reactions to some stress in your life that result in overly strong emotions. Okay, so and then you have some sort of change in your behavior. The key is that the reaction to this event is way more intense than would typically be expected in general review. So, as you might imagine, whatever that is can cause a lot of problems in your relationships, work, school, wherever. So, I want to say first that, we all go through stressful events in our lives. Of course we do. We, getting fired, divorced, death of a loved one, a big move. But with an adjustment disorder, that's the name. You don't adjust back to normal quickly. Maybe in a week or two. That's not, that you don't adjust back. I'm going to get very nitty gritty with you now because this isn't some 30-second soundbite. If you really want to understand adjustment disorders and think about whether this is you or not, you need to spend a minute with me learning and understanding how we diagnose. So I hear people sometimes, you're like, get to the point. This is the point. This is the point. We're so used to a 30-second reel on something or a YouTube short on something that's 2 seconds, and you don't get good information that way. I don't know how else to say that to you with all the love in my heart. You cannot put mental health conditions down to that. So if you're here for that, I'm not for you. I will tell you that right now. So I've mentioned before on the podcast that we mental health professionals use something called the Diagnostic and Statistical Manual of Mental Disorders to diagnose mental health conditions. Currently, this book is in its 5th edition. It was updated in 2022 with some text revisions. So it's now called the DSM-5-TR. There's a section of the DSM-5-TR called Trauma and Stressor-Related Disorders, which says that these types of disorders happen after an exposure to a traumatic or stressful event. And there are 5 disorders listed in that chapter. Okay. And though they include, there's reactive attachment disorder, there's disinhibited social engagement disorder, post-traumatic stress disorder, PTSD, which is probably the only one of these you've heard of, acute stress disorder, and adjustment disorders. That's the 5th one. So right away, you can see that it might be easy to confuse adjustment disorders with other problems, hence us going deep for this moment and you sticking with me. So just within trauma disorders, there's all these, okay? So just to be clear, that we have to differentially diagnose in between. But it's not, when you just come present to us, we also have to differentially diagnose between a bunch of other things that could be there. There are what we call diagnostic criteria that have to be met for a mental health professional to diagnose you with anything. And in this case, with an adjustment disorder. So with adjustment disorders, you need this. You need 1, the development of emotional or behavioral symptoms in response to an identifiable stressor occurring within 3 months of the onset of that stressor. So let's talk about that for 1 second. So it means that you got divorced, someone died, you got fired or laid off. Do you see where I'm going here? And within 3 months, so it could be right away, or it could be, it could have been delayed a little bit. You start to develop these more severe symptoms. Okay. You're again, like kind of overreacting or having outsized responses to what happened. Does that make sense? So you have to have that first, has to be within 3 months. And these symptoms or behaviors are clinically significant, meaning that we think they're important, as evidenced by one or more of the following. Okay. So you have to have the 3-month thing, and then it has to be one or more of these. Marked distress that is out of proportion to the severity or intensity of the stressor. Okay, so that's the outsized response to whatever the stressor was. Okay, taking into account the external context and the cultural factors that might influence symptom severity and presentation. So again, if you come from a culture where I don't know, throwing yourself on a dead person at a or a coffin or something, or yelling and screaming or crying, hysterical, something is usual, then just because you, let's say, now live in the United States or somewhere where that's not usual, and here in the United States that can be usual too. I don't mean to say it's not, but you know what I'm saying. It's then it doesn't fall in this category. It might seem like an outsized response to some, and that, by the way, is what happened with the client I just mentioned, where she's from originally. Her reactions were more usual, and what she saw growing up. And that's the reaction she was having. But here in the United States, people were freaking out, and she was freaking out, thinking that she was doing it wrong. Do you know what I'm saying? So you have to take in the cultural factors or those kinds of things. We also have to see, or we might see significant impairment in social, occupational, meaning work, or other important areas of functioning. The stress-related disturbance does not meet the criteria. So you don't meet the criteria for another mental health disorder. So let's say you already have extreme depression and someone died. You don't necessarily have an adjustment disorder after that. You might have an exacerbation or a worsening of a pre-existing mental health condition like your severe depression. Does that make sense? The symptoms do not represent normal bereavement, which I already talked about. Once the stressor or its consequences has terminated, so the divorce is over or whatever, or your loved one has died, the symptoms don't last more than 6 months, an additional 6 months. Okay? So the symptoms might not come on for a month, but it's not lasting more than 6 months after the initial death or whatever it was. Okay? So you got to have one or more of all of those in addition to the onset within 3 months. So there you go with what the criteria are. And then, okay, so, I'm looking in this big book, I find the trauma, section. And then within that, of those 5 types of PTSD or whatever, we say, oh, it's an adjustment disorder. And then within the adjustment disorders, there are 6 adjustment disorders listed in the DSM. Okay. See, my job is harder than you think. I know everyone thinks psychology is like a soft science, and whatever. It's not. There's very clear things, and I will tell you that over time, I've 39 years of experience now. That's a lot of experience in all kinds of different settings. So I'm going to be better at differentially diagnosing and getting the right diagnosis than someone else, someone with a year of experience, right? Or none or no degree, and you're just looking on Google. That's what I'm trying to say. And I say with all love in my heart, you can be very smart. It's not about how smart you are. It's about over time, you get kind of a spidey sense about things. Over time, you've seen the same thing over and over and over, and you realize, oh, when I see that constellation of symptoms, it doesn't equal this, it equals that. And that only comes with a lot of experience and usually a lot of broad experience. And even with all that, it's not like I've never missed a diagnosis or misdiagnosed someone. Of course, it's impossible not to. Do you see what I'm saying here? That's why I'm asking that you please get real help. But, okay, so there are 6 adjustment disorders listed in the DSM. So like how we write it, we'd say an adjustment disorder. And then we would say, if this applies, with depressed mood. So if your adjustment disorder shows up as a really low mood, a lot of tearfulness, crying for no reason, feelings of hopelessness, if those are predominant, we would call it adjustment disorder with low mood. Does that make sense? I hope it does. With depressed mood. Sorry. Or with adjustment disorder with anxiety. That's the second type. If yours shows up with a lot of nervousness, worry, jitteriness, separation anxiety, if that's predominant, okay? The third one would be adjustment disorders with mixed anxiety and depressed mood, okay? Where we get a little combo. And that's a combination of those symptoms of depression and anxiety, again, being predominant. The fourth one is, we would say, an adjustment disorder with disturbance of conduct. And disturbance of conduct, that's where that's predominant, where maybe you are being very impulsive. You're lashing out at people all of a sudden. You're You've screamed and yelled at your instructor in class. You've lost it on your boss. There's some sort of disturbance in how you conduct yourself. Sometimes that's sexually acting out. Sometimes that could be using drugs and alcohol, and like suddenly you're trying heroin or something, or trying or drinking way more than you usually do. There's a disturbance of conduct. Does that make sense? Okay. And then the fifth is with mixed disturbance of emotions and conduct. So that's all of them. You might have, both emotional symptoms like depression and anxiety, or one or the other, and a disturbance of conduct, again, are prominent, okay, are the dominant things we're looking at. And then the sixth one is something we always have, which is unspecified. We always have like a little trap door. And the sixth one would be adjustment disorders unspecified, which means that there's maladaptive reactions that are not really classifiable as one of the specific subtypes of adjustment disorder. But again, it seems to be adjustment disorder. And you can see how that is someone who's, if you're saying unspecified, you're someone who has a lot of experience, who's really looking at this very closely. Okay? All right.